Every 8th of March is observed as International Women's Day to recognize the contribution of women to society and national development. In the science space, women are positioning themselves to contribute to the health well-being of humanity. Irene Asaba Mugisha is one of the few plastic surgeons the country has. She is the only plastic surgeon at Mulago National Referral Hospital. Plastic surgery is a surgical involving the restoration and reconstruction of the human body and is divided into two main categories: reconstructive and cosmetic surgery. By press time, Asaba was working on a 5-year-old girl, a resident of Kawempe, who got involved in a border accident a month ago.
I've been working on a child, a 5-year-old, who had an accident and they got a soft tissue injury on the scalp. They lost scalp skin and the bone was left to be exposed. So we have been doing what they call scalp reconstruction to cover the exposed bone and realign the scalp accordingly. So that's the procedure that we just did, and it went well, successfully.
Asaba, being the only plastic surgeon at Mulago National Referral Hospital, serves almost all departments.
Burden of reconstructive needs is way too high in proportion to the plastic surgeons who are available in the country. So at the moment we're about maybe 15, some of whom are abroad. So currently there could be about 12 in the country, distributed within Kampala, and maybe one up country in Barara. So the burden is high. We cannot exhaust it.
But what inspired Asaba to choose what she does?
What inspired me? Many things. One, it's challenging. I like challenging specialties. And then it's challenging in such a way that every patient comes in a unique way. It's not like they read books or there's a formula, do ABCD, no. So what guides us is principles, and so the minute a patient walks in that door, you just start thinking, like, how am I going to sort them? You don't sleep until you know, okay, I'm going to do this. If this fails, I'm going to do this on table. So you have to have a plan A, B, C.
The number of patients requiring plastic surgery or reconstruction is also high, yet the specialists are few.
Post-burn, they have post-burn complications like scars that need to be released or contractures that need to be released. Most of them are trauma cases from accidents like this child we worked on. The others are patients who've had chronic wounds for some time, the diabetics, the immunosuppressed patients, that kind. So they come with wounds that have stayed for some time, and so we manage those accordingly. We excise those, and then tumor excisions, cancers, and all that.
Like any other surgical procedure, Asaba works with other nurses, and Nimusima Vastin is one of them.
The role of the theatre nurse is to assist the doctor. There are two types of theatre nurses. You can be a scrub nurse, you can be a running nurse. A scrub nurse, you scrub in with the doctor and stand on the table, on the operating table with the doctor, and you're in command of all the instruments that are going to be used to work on the patient.
Women in the medical profession have challenged young females to always aim higher.
I would like to inspire a girl child that you can make it, because we've also made it, irrespective of where you're going to start from. And Uganda still needs nurses out there, because nurses spend most of the time with the patient.
The government of Uganda has provided a conducive environment for women empowerment, although there are challenges that need to be addressed, like retention of girls in school. Marion Awori and Adia Nakuti for UBC News.